I'm Dr. Trang No with Good Focus Dentistry, and this is,
I'm Maya Suzuki with Bumblebee AcuTherapy.
we have to introduce a little more.
Oh yeah, and this is Okane.
Yeah,
he's my fourth, and he hangs out with me every day. So
very cute. Little fun of joy, huh? All right, so this morning, I'm so glad that you guys joining us. We want to kind of talk, we want to get together and kind of talk a little bit on how and when to advocate for your child in two very big issues that we feel that a lot of new mothers or young mothers is facing, which is reflux and tongue tie.
definitely.
And I think our main goal is just to make sure we share these informations to you guys, so then you know when things are normal, when it's not normal, what to look for, and I think also learning about alternative method that you can treat these symptoms,
Definitely.
which to me is very important.
I think the first stage of being able to advocate is definitely understanding what's going to happen when you go into the doctor. And then when you go into the doctor, what questions you should be asking, and then what alternatives will you have to the care that he or she is probably going to, recommend to you.
Yeah, and I also, not all providers are the same, and just to know when that provider's viewpoint and yours is not aligned, and how to move on from that. And also, I think just being an informed parent, I think, is the most important part.
I agree.
Because not everything has been done that you know about in the United States for a long time. We are not a culture of preventative care or different type of Eastern medicine kind of care, which is, I think, is very, very important to know that there are different options out there. So to start off, I think that, as parents, when my infant has projectile vomiting, it's not fun.
That's never fun.
The most important part is let's talk about reflux this morning.
Okay. Well, actually, before we get into that, I would love it if maybe, Dr. No, could you introduce yourself just a little bit and kind of what you're doing at the office? Maybe I'll introduce myself and then go into the acid reflux.
So this is my practice, Kid Focus Dentistry, and we are really about not just treating your child dental-wise. We are looking at your child when they come in for an exam, because there's a lot of evidence inside the mouth, especially growth and development, that allow us to diagnose a lot of other things. So our motto here at Kid Focus Dentistry is dentistry with a whole child perspective. Because if there's different clues that kind of tell us about, like there's speech problem, there is reflux problem, there's airway issues, we definitely want to help your child with that. So that's our main focus, is really helping your child as a whole person, not just cavities wise.
Yeah. And then also, just in case you guys are watching, not on the Facebook Live, because this will also be on YouTube, if you make sure you watch to the end, first of all, because I'm going to be giving some tips and tricks on acid reflux and how you can help your child at home. And then Dr. Noah is going to be also sharing a really awesome video that they also made concerning tongue ties and things like that. So make sure you watch to the very end. Okay, so my name is Maya Suzuki, as I just said. I run Bumblebee AcuTherapy, which is a pediatric and perinatal acupuncture clinic, and also AcuTherapy. So AcuTherapy is essentially acupuncture without the puncture. So I'm able to treat kids from 0 to 14 without using traditional acupuncture needles, but still getting the same effect as if you were getting traditional acupuncture or moxibustion therapy. The reason why I decided to do pediatrics in particular is because I trained in Japan, and when I came back here, I just realized that, at least in Colorado, there are very, very few acupuncture clinics who have very specific training in pediatrics. And I really did think that that was an underserved population in our community, and I wanted to make sure that kids get just as much care as adults do, because it works really great. So saying that, I'd like to kind of talk about the acid reflux.
Yeah.
Whoopsies. You're going to have to wait for that one, buddy. So acid reflux, in general, most parents think, okay, acid reflux, my kid's spitting up. A few times after breastfeeding, spitting up like once, a little bit, is completely normal. But when your kid is projectile vomiting, as Dr. No said, that is not normal, and that is also something that you can get help with. So first off, let's talk about how you would normally get help in Western medical care. So normally when you're having a problem with your baby spitting up too frequently, you're going to go to the doctor, and they're going to tell you, oh, well, we think the baby has acid reflux. And so we're going to, first what we want you to do is start to change your diet, because the baby might have allergies to what you're eating. And so a lot of moms will try to change their diet. Right now the fad is to take out gluten, to take out eggs, milk, peanuts, anything with acid in it, so like grapefruits or anything like that. Oh, geez. Anything like that.
His digestive system working very well.
It's working very well. So yeah, that's the first thing that'll happen. And then usually what happens is mom gets really frustrated because mom has to change her diet very quickly, which isn't good for her digestion. And then it ends up not working. And so they go back to the doctor, and the doctor says, okay, well, we're going to give you some medication for this. The unfortunate part about that, and which something that Dr. No and I have talked about and a lot about actually, is that the medication that they give to kids is not tested on kids, because it is unethical to test this medication on kids. We have no idea what this medication will do to them 30 years down the road, and honestly the medication was never developed for them. So it's a very tricky line, and I think if the medication is helping, that's great, but I definitely think there are other moms out there who are like, I would rather solve the problem rather than, just cover it with the Band-Aid of a pill.
Well, there's has been a recent research showing that these type of medication, although it's helping with the symptom, is inhibit the child from absorbing the nutrient because you are changing the acid environment in the tummy. So that is the long-term consequences, where I think that, I think every drugs have a double-edged sword.
Yeah.
So we need to be aware of that.
Yeah, definitely. Thank you for bringing that up. So often when I see these kids, it's usually after they've taken the medication, unfortunately, because by the time the mom comes to me, they've tried everything. I would love for them to try this first, but usually what happens is by the time they come to me, the acid reflux isn't any better. They're having problems breastfeeding. Sometimes they're having to switch to formula milk, and on top of that, the acid reflux has really affected their GI tract, and now their GI tract isn't functioning correctly. They tend to have a lot of gas in their system. They tend to not either be constipated, usually more constipated than having diarrhea, but every once in a while you do see the diarrhea, usually more constipation. And so what I do is I can go in and actually help their system to have a restart. So the first thing that I usually advocate for, of course in coordination with your doctor, is to take the baby off the acid reflux medications. And you can go, buddy. So that's the first thing that I advocate for, but of course I want you to follow what your doctor says. And then we start with a few treatments of AcuTherapy. And AcuTherapy I do for all of my kiddos. He got AcuTherapy the day he was born. I do it for my 9-year-old. It works incredibly well for so many things. And it takes about, for a baby, 2 or 3 minutes of treatment, and then usually it's all over. And for acid reflux, normally 2 or 3 treatments tops, and the baby is no longer spitting up a lot. Usually the constipation is resolved and they're breastfeeding normally. So what that involves is really just, again, this needleless treatment, and then I also use a moxibustion, which I have a few other videos on, so you guys can scroll through on my video feed on YouTube to find that. But it's a really, really easy, gentle treatment for the baby, and the baby can be breastfeeding while they're having it done. They can be playing while they're having it done. And that's true from any age, from 0 all the way up to 3 years old. Although I'd have to say, and I want to ask you about this, when you see babies, what age are you usually seeing with the acid reflux? And then also, when I see these babies, I also see a lot of issues going on with their mouth besides just the acid reflux. There's always, there seems to be always more issues, like I said, the constipation. And then there's these other issues like, lip ties and tongue ties. I'm wondering what your experience is with that.
So to start off, I think that we just want to make sure that it's not just the projectile vomiting and the constipations that plaguing these children. I think it's the discomfort of it.
I'm sure it feels horrible.
I see infant like 1 or 2 weeks old to do a tongue tie release, and this is the big issues for that. And the parents say the child cry all the time, arching his back, and that's because of this discomfort that they are experiencing. So I think even if not the projectile vomiting, I think the discomfort, to me as parents,
it's just
brand new
bad.
parent, and I think it's just heartbreaking. So just to address that, and reflux and tongue ties, I think goes together a lot of time, because what happened is if your child is tongue is tied down and not getting that nice latch, or also in addition to that, getting a lip tie and not getting that nice seal, what happens is they're going to ingest a lot of air all the time. So when you have a lot of air in your digestive system, acid reflux is usually a symptom of that. And I think that's why we kind of want to talk to moms about this situations to get us together as a whole, because I think that with tongue tie, a lot of time what mothers think of is just breastfeeding. But sometimes if the mother anatomy is so good, you might not experience that much of difficulty with breastfeeding, but the long-term consequences of it is like something like acid reflux, which I diagnose all the time in my clinic on the kids that is younger. Let's say 5-6 years old, I can tell when the kids have acid reflux. Those are the kids that grind their teeth a lot, with a lot of divots in the teeth, and
Definitely.
It does play into their sleeping, because now they experience heartburn, but because it's such a chronic problem that they think this is normal all the time. So that's one of the big issues on that. But the tongue tie also, if you think about the tongue, it is the most dynamic and forceful things in your child head and neck area. And it shaped the way that their airway is formed, it shaped their speech, it shaped their TMJ. So it has so much of the long-term effect. And I think the main thing that we really want to take away from this is we do not like the term let's wait and see. I think that if you look at a baby, like 1 day old versus 2 months old versus 6 months old, and you see the rate at which they are growing, you realize that they are growing at an extraordinary rate. But guess what? Any kind of dysfunction, bless you, any kind of dysfunction that your child has is also growing at that alarming rate. So then therefore, to treat it down the line, I think is a lot harder. For me,
It takes more time.
Yeah, it takes more time, and for me, I prefer to do tongue tie release under 8 months and under, because the nerve has not innervated yet. So when I go in, it takes me 30 seconds. I don't have to numb up the infant. I just do it really quick. The healing is a lot easier. That you can do the exercise, which is extremely, extremely important to do the exercise correctly for it to heal correctly.
I've actually seen, not to cut you off, I've seen a lot of moms recently in my clinic that come in for tongue tie aftercare. And they say, well, I said, have you been treated? They just went in to get it re-released. And I said, well, why did you have to do that? Weren't you doing the aftercare? Weren't you doing the stretches? And they said, oh, well, no, they just released it. And they said I didn't have to do anything.
Releasing is actually the easiest part in tongue tie release. Is the easiest part. It's the aftercare. Oh, yes.
Is that right?
He has so much opinion on this. He's very passionate about it too. But yeah, but if you wait until your child is older, I mean, I don't even recommend release at 1 or 2 or 3 years old. It's just because the release, I mean, I can do, it's a little bit more difficult, more painful, but they won't let you do the exercise. They will bite you. They won't let you do the proper one. So then we get ourselves into maybe more problem than really helping your child. So that's why we really, really want that you feel, I think as a parent, you always have that gut feeling. They say, hey, this is not normal. Breastfeeding shouldn't be painful. You shouldn't have to tough it out.
Never.
So I think just getting someone to help you to diagnose correctly, I think is the number one thing. And I will provide a link in this video. On this video I made for expecting and young mothers. And part of that, you can go to the timestamp for what different type of ties. It's not just a tongue tie, which is the more prominent one, but there's lip tie and there's what we call buckle ties. So, you can kind of see how does that relate to the breastfeeding aspect, but the long-term aspect. And we have a lot of video on our YouTube channel that does that too, talk about the long-term effect of things. But ultimately, we just want you to help you as parent to advocate for your child. And I think the hardest thing about the struggle that I have as a provider is that a lot of time you're going to run into no's, because there's certain provider that are a little bit more old school, and they're like, "Whoa, I don't believe in that." So they just wait and see, and you have to know when that no is not okay for you, and when to like push and advocate for your child.
I agree. I mean, I think definitely getting, you know, especially when it comes to your baby, get that second and third opinion. Really think about all of the information that each of the providers has given to you. Make sure that you're really advocating for your kid in the best of your ability. And then I would definitely, you know, go on YouTube. Dr. No has some really great videos about tongue ties and about different stretches you can do at your home. You know, if you're not in the Colorado area, you know, still go and check those out, and then try to find a good provider in your area. You can definitely contact us and see if we have someone in our network that can help you, that is in your area. I'm always up to having more people get more AcuTherapy for their kids, and there are many providers across the United States and in the world who really do specify in pediatrics, and you know, and tongue ties as well. And if that goes just doubly for dentistry, I think it's also really important that you have a really good team that works with you and your child. So like having a really good IBCLC who can help you with latches and things like that, who can help you get some workarounds when the baby is still healing and their tongue is still learning how to work again, you know. Really get that community around you to help you have the best experience for yourself, and make sure that your child is really going to grow in the best way that they possibly can.
Yeah.
So for those of you who stuck around to this point, thank you so much for watching.
Yes,
I
thank
appreciate that you took your time, and I hope you got some value out of this video. If you guys would like to, if you are experiencing some acid reflux with your baby, I'm going to show you a great place that you can do some heat treatment. It's very easy to do heat treatment. You can take a blow dryer. I just want you to be very, very careful. Make sure that you're never, ever, ever putting too much heat on your child. And they'll definitely tell you when it's too hot. Like if you put them in a too hot of a bath, they let you know. So just be really gentle with your child. Essentially what you're going to be doing, little Okune, he's going to be my little model here. So usually when they're having acid reflux, right here in the middle of their back, which is essentially the back of their stomach, if you can think of it that way, there'll be a little bit of a depression here in their spine. So their spine will be normal, and then it will just be a little bit concave. And if you just run your hand along their spine, you know, just when they're laying on their belly and doing some tummy time, or while you're holding them, you should be able to feel that. And if they're having acid reflux, they'll definitely have that divot there. That's essentially what their stomach is doing, is their stomach is not working correctly. It's very tight, and it's pulling towards the front and kind of pulling into itself, which pulls the fascia and then the spine towards the front of the body, and that creates that little divot. There's other reasons in Eastern medicine why we think that happens, but for now, just the Western part. So what you're going to do is you're going to take your blow dryer, and maybe for a second on very low heat, you're going to go 1 and then take it away. 1 second, take it away. Never leave it there for more than a second. And I would do that maybe 3 to 5 times, a few times a day. Again, make sure that you're listening to your child. If your child says it's too hot, it's too hot. Most of the time, when you do this for them, though, they'll just feel nice and warm, and they'll feel very relaxed. And then also make sure you keep the rest of their body warm while you're doing that, because kids who have acid reflux, again, their digestive tract is not working correctly. And that obviously the stomach is just one more piece of that. And it starts really at the tongue, which again, why is the tongue tie so effective at treating all of these other issues, releasing the tongue tie, excuse me. But just warming up here is going to help the digestive tract work. It might help a little bit with the constipation even, and it'll help ease their acid reflux, on top of getting a really good dentist, maybe getting an IBCLC, and then also seeing some AcuTherapy.
Yeah, I think like the team approach is really, really important, because I think we are treating the body as a whole, and the tongue doesn't go away from the mouth, it doesn't go away from the tummy. We are connected, so I think that's sometimes your child might need more than one thing, but don't be discouraged. And I think the key is whatever you are helping your child when they are infants, I think that you can truly help fix the problem, rather than when you wait until they're older, you're just trying to make them better, but never whole, you know, like perfect. So I think when they are young, there's so much more option and much easier things to do.
Definitely.
So early intervention or prevention in general, I think, is always our approach to helping you to help your child to grow healthy and well. Yeah, I think, you know,
What do you think?
He has a lot of great idea.
You think so?
Yeah.
Okay, so we tell everybody thank you for watching.
And bye-bye.
Bye-bye.
Thank you guys. Bye.
Thank you.